Hi everyone, this is Katie Kelly, one half of Motherhood Link, and I'm here with another tip for you today. We get asked a whole lot about some tips on what we should do for pushing when we're prepping for a vaginal birth. And there's no one way that I really like to teach pushing, but there's one tip that we do give all the time, and that is to learn how to relax your pelvic floor or your Kegel muscles. So I talk about this for a couple of different reasons. One, I think that some women just don't even know that they can relax those muscles. So we talk so much about Kegels and getting stronger because we don't want to pee our pants that sometimes learning how to relax those muscles gets neglected. Number two, some women have this pushing strategy where they're just going to push so hard and they squeeze so much in their abs that they actually end up squeezing the pelvic floor underneath as well. Not super effective when you're trying to actually get something out of there. And then three, I think we underestimate how scared some women are to actually poo on the table when they're pushing. So rest assured that happens to a lot of women. It's very normal, but the nursing staff is usually really good at dealing with that. So they keep you covered as long as they can. There's lots of padding because there's other stuff that's coming out during that time too. So if anything happens to land on the pad, they'll fold it, they'll get rid of it, they'll chuck it. They've got your back. So in learning how to relax the pelvic floor, how do we do that? I'm going to grab my pelvis again. Okay, back to the pelvic floor. So the pelvic floor, the Kegel muscle, starts at the pubic bone in the front. See right here, and it slings between the legs and attaches to the tailbone in the back. It's all inside there. So there's a front and a back half. And just like I teach Kegels thinking about squeezing and lifting in the front and squeezing and lifting in the back, you have to know how to put those back down and open them for relaxation. So I will tell women, take 2 fingers and put it just to the inside of the sit bone, so the bone in your butt cheek. Put it just to the inside of that and relax everything. And when you take a nice deep belly breath or kind of a yoga style breath in, you should feel a little bit of give down by your fingertips. So when you press air downwards and fill the lungs, you should have a reciprocal give down on the bottom. And that's a really good test to see if you're actually relaxing. So you want to practice that a few times. I usually recommend about 5 breaths in a row to make sure you've got it. Some women will try to practice those as well when they're on the toilet having a bowel movement. But if you find that you're struggling with it, go into a local pelvic floor physiotherapist and ask for them to teach you how to do a relaxation, and make sure that that's a skill that you have a pretty good understanding of before you get into the labor and delivery department. All right, good luck with that. Have a nice day. Bye-bye.